You know that feeling of being tired all the time? It's so easy to just blame our busy lives, right? But what if it's actually something more? Today, we're going to talk about anemia, a condition that quietly affects millions. And trust me, its consequences can be way more serious than just feeling a little worn out.
So let's kick things off with a number that really puts this whole thing into perspective. 1 in 5. Get this, according to the health data, 1 out of every 5 maternal deaths is directly caused by anemia. That's huge. This isn't just about feeling tired. It's a critical global health issue.
So that leads to the big question, right? What exactly is this condition? We're going to break it all down, and we'll use a pretty simple idea to do it. Think of it as the oxygen delivery problem. Okay, so here's the deal. At its very core, anemia just means your blood can't carry enough oxygen to all the parts of your body that need it. And this usually happens for one of two reasons. Either you just don't have enough red blood cells, or those cells don't have enough of this really important protein called hemoglobin. I love this way of thinking about it. Imagine your red blood cells are like a massive, super efficient delivery service for oxygen. They're constantly rushing to every single part of your body. Well, anemia is what happens when that delivery service is understaffed or maybe their delivery trucks are faulty. The result is always the same. Your body's tissues are basically being starved of oxygen. But here's a really crucial point. Anemia isn't some one-size-fits-all problem. There are actually several different reasons why that oxygen delivery service might be failing. So let's take a look at the main types. All right, let's break down the 3 big ones you see here. First up, iron deficiency anemia. This is by far the most common type. Think of it as a supply chain issue. If you don't have enough iron, your body can't make enough hemoglobin, and your red blood cells end up small and pale. Then you've got megaloblastic anemia. This is more of a production problem, usually because of a lack of vitamin B12 or folic acid. Your body's factory, the bone marrow, starts making cells that are way too big and too immature to actually work right. And finally, there's hemolytic anemia. This one's a destruction problem. Your red blood cells are literally being destroyed faster than your body can make new ones. And if you want to understand the sheer scale of this, especially the iron deficiency part, just listen to this fact. Every second Indian woman is anemic. Wow. A statistic like that really changes your perspective, doesn't it? It goes from a personal health issue to a massive public health challenge. So how would you even know if your body's oxygen delivery service is, struggling? Well, your body is actually pretty good at sending out warning signals. Let's talk about how to listen for them and spot the symptoms. These right here, these are the universal signals that your body is being deprived of oxygen. That constant feeling of being wiped out, a heart that races when you barely do anything, getting out of breath, these aren't just signs of being out of shape. It could be your body screaming for more oxygen. Things like pale skin and leg cramps are also classic signs that your tissues just aren't getting the fuel they need. And what's really fascinating is how the body gives you different clues for different problems. With an iron deficiency, you might get these bizarre cravings for non-food stuff, like ice or even dirt. That's a condition called pica. Or you could see physical signs, like your nails starting to curve upwards. But with a vitamin B12 deficiency, the clues are often neurological, that pins and needles feeling, losing your sense of touch, or even having trouble walking. It's kind of like your body's trying to tell you exactly what it's missing. Okay, so we've talked about the problem and we've talked about the clues. So what do you do about it? Well, thankfully, there's a really clear and structured action plan for figuring it out and managing it. And the best part is, it's not some complicated, scary procedure. Finding out almost always starts with a simple blood test. A doctor will check your hemoglobin and your hematocrit levels, which is basically just the percentage of your blood that's made up of red blood cells. Those two numbers give a really clear, immediate picture of how well your blood is doing its job. Now, the management process itself is so important because it's not just about taking a pill and being done. Step 1 is figuring out the root cause. Step 2 is, of course, using supplements to get your levels back to normal. But you don't stop there. Step 3 is absolutely crucial. You have to keep going for another 4 to 6 months to replenish your body's stores, to build up a reserve. And finally, step 4 is all about the long game, learning how to keep those levels healthy through the food you eat. Following that plan has huge benefits that go way, way beyond just feeling less tired. So let's talk about the payoff. Why does treating this condition matter so much? I mean, look at this. The benefits are they're life-changing. In kids, it means better cognitive development. For all of us, it means more energy, better fitness, a higher capacity for work. And this brings us right back to that shocking number from the beginning. For pregnant women, treating anemia dramatically decreases maternal mortality and the risk of having a low birth weight baby. It improves and it literally saves lives. So we'll leave you with this thought. Feeling completely exhausted has kind of become the norm in modern life for so many of us. But is that fatigue really just a part of life? Or could it be your body trying to tell you something more? If any of what we talked about today sounded a little too familiar, maybe it's time to find out.